The practices of organ procurement is under a national investigation by the Department of Health and Human Services after what lawmakers call a horrifying situation in Kentucky under one of the nation's major organizations. I spoke to the state's nonprofit organization, the Louisiana Organ Procurement Agency, to address the situation, explain their practices, and the ethics of organ donation. The United States has 58 different organ procurement agencies in the country that all fall under federal guidelines, but differ in state guidelines. Louisiana's is stricter.
Louisiana is very unique in its approach to certain safeguards for patient safety, particularly around the declaration of death. That requires 2 physician signatures on any declaration.
Bailey Morse is the chief legal officer for the Louisiana Organ Procurement Agency. When asked if there is mismanagement nationally, she explains how the differing standards could lead to rare situations, such as what took place in 2021 under the Kentucky-based nonprofit Network for Hope, when a patient's organs were allegedly about to be harvested before a surgeon realized the patient was not actually dead yet.
Represent some of the rarest occurrences. They are real, and they're real enough to generate public concern and maybe some confusion.
She says LOPA takes any concerns extremely seriously. The organization follows strict adherence to internal policies.
Is to not only earn the public's trust, but to maintain it.
She represents LOPA because she's also an advocate with a personal connection. Her mother-in-law, Robin, was once a recipient.
About 20 years ago, she was placed on the transplant list. She was awaiting a liver transplant. About 15 years ago, she received that wonderful call that there was a donor for her and that she was going to receive a very much needed organ. Through that loving gift, she lived 15 full years.
Then Robin became a donor herself.
She was able to make that last gift to someone else and give another family a new tomorrow.
Hospitals inform LOPA when there are candidates for organ and tissue transplants. The candidates must be declared deceased or on a ventilator and deemed brain dead.
We are there to advocate for the decision that a patient may have made by, say, registering themselves.
Nationally, more than 100,000 people are on the transplant waiting list. In Louisiana, more than 1,800 patients are on the list. LOPA's chief operating officer, Chad Ezell, says donor registration has grown in recent years, providing more than 800 transplants.
Over 800 lives were saved through the work of LOPA.
They say LOPA goes beyond transplantation. They help donor families navigate the emotional process.
And we support the donor's family through grief counseling from the time that the process initiates all the way post-recovery.
They explain people should not fear becoming an organ donor. It is the ultimate gift to give a stranger.
At the end of one's life, you have the opportunity to save another life.
And for the families left behind, it connects a lasting legacy between lives lost and lives saved. I'm Alexandra Meacham reporting.